This is Dr. Ramesh Kawar. I am an interventional cardiologist attached to Bombay Hospital, Breach Candy Hospital, Surana Group of Hospitals, and in Malad at Riddhivinayak and Lifeline Hospitals. I am in the field of interventional cardiology from last 20 years, doing interventions for coronary and non-coronary situations, for valvular treatments, for congenital heart disease, and other interventional fields. Today we are going to talk on hypertension. As you know, hypertension is a very common illness which is affecting, and it's a non-communicable disease which is affecting Indian population at large. If you see the prevalence of hypertension in India, in rural population is somewhere around 5 to 7%, while in urban population it is around 10%. So a huge chunk of our population is suffering from hypertension. Unfortunately, diagnosis and the treatment of hypertension remains poorly managed, in the sense that almost 25% of our patients are not diagnosed, though they are suffering from hypertension. According to the latest ACC-AHA guidelines, almost 25% are remain undiagnosed. Roughly around 25% they are diagnosed but they are not treated properly. Similarly, around 25% of these patients who are diagnosed are treated poorly. Only 25% of our patients who are suffering from hypertension are being treated properly. So there is roughly a 25% rule. It is important to treat patients with hypertension. Why? Because if we keep these patients untreated, they are going to end up with lot of cardiovascular disease problem, like patients suffering from a stroke because of either ischemic stroke or bleed in the brain, or they may suffer heart attack like myocardial infarction, or die from arrhythmia because of hypertensive heart disease. They may also suffer from kidney problem and leading to end stage renal disease and dialysis. They may suffer from retinal problem with loss of vision. So it is very important to treat and control their blood pressure so as to prevent all these deadly diseases. Now, there are various stages of hypertension. Normally we say that a patient whose normal blood pressure is less than 120 millimeter systolic and less than 80 millimeter diastolic. And then we call as stage 1 hypertension, where your blood pressure, systolic blood pressure is between 130 to 139. Earlier it was 140 to 149, but now with the latest guidelines, 2017 ACC-AHA guidelines recommend that any person who is having systolic blood pressure more between 130 to 139 and a diastolic blood pressure of 80 to 89 is classified as stage 1 hypertension, and anything more than 140 millimeter of systolic and more than 90 millimeter of diastolic is classed as class 2 hypertension or stage 2 hypertension. Irrespective of their stage, we have to take proactive step to control their blood pressure, either by non-pharmacological means or by pharmacological means. Non-pharmacological means should be tried for each and every patient, whatever stage, because it is very important, and there are various ways by which you can control blood pressure. If you are obese, then reduction of weight will help you in controlling your blood pressure. Reduction of salt intake less than 2 to 3 grams per day will help you in reducing your blood pressure. Similarly, increasing potassium intake like fruits, vegetables, lot of vegetables and fruits, especially fruits containing citrus fruits like juicy fruits like oranges, sweet lime, all these will help in bringing down your blood pressure. Regarding the salt intake, you have to avoid all the salty things like pickle, papad, baked products, processed foods, junk food. You have to avoid all these to reduce your salt intake. Home cooked food is best. Besides salt and potassium and weight reduction, other non-pharmacological measures which will help you in controlling your blood pressure is cessation of smoking if you are a smoker, reduction of alcohol to less than 60 ml per day for adult males and less than 30 ml for women should be encouraged. Then also regular physical activity is very important. in controlling your blood pressure. You should walk for at least 30 to 45 minutes of brisk walk, at least 5 to 6 days a week, now if not for all days, but minimum 5 days a week, and 30 to 45 minutes of brisk walking. You can also do yoga, meditation and other things to control your blood pressure. If your blood pressure doesn't come under control with these measures, then one can start with pharmacological treatment. You have to control your blood pressure by whatever means. Even if you have to take one medicine, two medicines or three or even four number of medicines, it is very important to keep them under control with the help of drugs which are very effective in controlling your blood pressure. If you control your blood pressure properly, you are less likely to suffer from other cardiovascular disease mortality. So it is very important to control your blood pressure, be aware about your blood pressure and try to control it by whatever means, which includes non-pharmacological treatment as well as pharmacological treatment. So to book an appointment with me, you can contact me through Lybrate.com.